Today, we uncover the silent assault on your digestive system caused by acid blockers, particularly proton pump inhibitors or PPIs. While these medications are widely prescribed and often taken without concern, mounting evidence reveals hidden dangers that compromise your gut's natural defenses. This session is dedicated to recognizing those risks and exploring ways to protect and restore your gut. I'm Dr. Khalid Rahman, and together we'll journey through the science, the symptoms, and the solutions that can help you reclaim your digestive well-being.
Proton pump inhibitors or PPIs are often hailed as wonder drugs for heartburn relief, but 20 years of rigorous research has revealed a mind-blowing outcome. PPIs are a silent assault on your beloved gut. Long-term use of these acid blockers can quietly dismantle your digestive defenses. They increase the risk of infection by weakening your stomach's antimicrobial barrier. They trigger nutritional deficiencies by impairing the absorption of vital nutrients like vitamin B12, magnesium, and iron. And they compromise the gut microbiome, disrupting the delicate balance of beneficial bacteria that protect your immune system and support digestion. This isn't just theory, it's a scientifically documented crisis that demands attention. Your gut deserves better than a silent sabotage. PPIs enjoy the fame of being the popular class of acid blockers. Their widespread use is driven not just by medical necessity, but by high prescription rate and aggressive ad campaigns. Research tells us that on a global scale, PPIs are counted among the top 10 most prescribed medicines. Within the United States alone, nearly 100 million PPI prescriptions are written each year. Here comes the shock. Approximately 70% of those receiving PPI treatments, they do not have any medical need for this acid blocker. Whether it is a vague stomach discomfort or mild heartburn, doctors often reach for a pharmaceutical band-aid. But these symptoms could have been managed with simpler, safer remedies without a single dose of PPI. A study published in Therapeutic Advances in Drug Safety revealed that a constellation of serious adverse events is the destiny for those consuming PPIs long term, regardless of the medical necessity. Your gut is much more than a digestive factory. The stomach produces approximately 2 to 3 liters of gastric acid daily. This acid has the capacity of a battery. Maintained at a pH of 1.5 to 2, stomach acid is a boon to your gut health. It acts as a sterilization chamber that paralyzes harmful parasites, viruses, and bacteria even before they think of attacking your gut. It's also a liberation factory for all your nutrients. Without its action, the separation of minerals and essential vitamins from complex dietary proteins is almost impossible. Stomach acid activates powerful enzymes like pepsin, which break down proteins and facilitate digestion. It's a clever gatekeeper that maintains the overall balance in the gut microbiome. But here's the critical concern. Long-term use of PPIs not only minimizes the production of acid, it irreversibly blocks the proton pump driven by gastric H plus K ATPase. This means PPIs slowly and gradually dismantle your gut's ecosystem, which is the essence of digestion. Without stomach acid, your gut can never remain happy and healthy. Truthful research tells us these shocking facts about PPIs. I could visualize a deeply troubling picture as soon as I collated mounting evidence from dozens of scientific studies regarding the long-term use of PPIs. An umbrella analysis of 65 scientific studies encompassing 28,000 patients revealed remarkable and critical findings. Compared to non-users, individuals with prolonged PPI use face significantly elevated health risks: an 18% higher risk of stroke, a 20% higher risk of heart attack, a 44% higher risk of kidney disease, and of course, a 48% higher risk of death. These aren't just numbers, they're warnings. PPI is often taken casually for heartburn, can quietly escalate into life-altering complications. The domino effect of PPIs is unimaginable. Slowly and gradually, they impact the entire body system and increase the risk of serious complications manifold. PPIs brutally exploit the gut microbiome. A recent study utilizing advanced DNA sequencing methods revealed truly shocking results. The findings from this study identified PPIs as the greatest enemy of gut bacteria. This study was conducted for almost 3.5 years on 1,800 individuals. The key results said that PPIs create an unhealthy gut by disrupting the diversity of its microbes, increase the population of infection-causing bacteria such as Streptococcaceae and Enterococcaceae, minimize the population of gut-supporting bacteria like Lactobacillus and Bifidobacterium, impact the manufacture of short-chain fatty acids, and disrupt the metabolic processes. The research disclosed that the adversities caused by the consistent use of PPIs do not subside despite adjusting for other health conditions and medications. Vulnerable gut and the infection highway. PPIs challenge the antimicrobial barrier in your stomach, and this is how they create a dangerous highway, providing an easy to access route for infectious microbes. A meta-analysis conducted in 2024 revealed a 65% increase in Clostridioides difficile infection among 300,000 individuals who were dependent on PPIs for their stomach issues. Stomach acid can deactivate Clostridioides difficile spores before they reach the intestine. However, since PPIs weaken stomach acid, these toxic spores have all the scope for germination and survival. Their prosperity proves fatal for the delicate human body. They brutally invade the inner lining of the intestine, interrupt the digestive processes, and weaken the immune system. PPIs do not stop here. They give an easy passage to acid bile bacteria by reducing the production of stomach acid. These bacteria escape the stomach when their greatest enemy, stomach acid, is weakened. They grab this grand opportunity and make the upper respiratory tract their new home. At times, particularly during sleep, they invade the airways and increase the risk and prevalence of lung infections. I was stunned to know that regular consumers of PPIs have a 70% chance of pneumonia, which increases further with higher doses and longer duration of PPI treatment. The silent starvation. The slow starvation caused by the long-term use of PPIs is insidious and adversely impacts your health and well-being. A single act of stomach acid suppression over and over for months to years leads to severe deficiency in vitamin B12, magnesium, and iron. Let's begin with vitamin B12. An acidic environment is a mandatory condition to separate vitamin B12 from dietary proteins. Due to the scarcity of stomach acid, vitamin B12 remains unused and attaches to the proteins of the consumed food. An umbrella analysis of multiple studies in JAMA revealed a 42% higher risk of vitamin B12 deficiency in PPI users compared to non-users. This deficiency can trigger progressive weakness, memory issues, numbness in extremities, mood disorders, depression, and irreparable nerve damage. Next, magnesium, the master mineral under attack. The US FDA issued a safety warning stating that prolonged consumption of PPIs can result in subnormal levels of magnesium, commonly known as hypomagnesemia. A research study found that PPI-induced low magnesium levels occurred in 77% of PPI users. This deficiency can result in tetany, cramps, muscle weakness, abnormal heart rhythms, altered mental status, seizures, and bone demineralization. And finally, iron. Gastric acid is the key to iron absorption. It's the mechanism by which absorbable ferrous ions are extracted from dietary ferric ions. A scientific analysis revealed that 21.3% of those with PPI-directed treatment are impacted by iron deficiency anemia. This leads to a severe decline in cellular energy production, impaired immune responses, poor focus, and even restless-like syndrome. PPIs don't just suppress acid, they suppress the vitality. The hidden epidemic, small intestinal bacterial overgrowth or SIBO. Small intestinal bacterial overgrowth is the most underrated outcome of long-term PPI treatment. The role of stomach acid is to lower the bacterial colony forming units to less than 1,000 per milliliter. This is the most effective way to maintain a sterile environment inside the small intestine. However, when PPIs compromise the concentration of stomach acid, bacteria get an easy opportunity to spread across the colon and cause abdominal discomfort and chronic bloating. Alternating constipation and diarrhea are other significant issues caused by the unpredictable bowel movements occurring due to the bacterial overgrowth. This bacterial overgrowth leads to nutrient deficiency due to malabsorption, food intolerance, especially to food maps, brain fog, and fatigue caused by bacterial metabolites, and leaky gut syndrome, and also known as the elevated intestinal permeability. Findings from a systematic review revealed that prolonged consumption of PPIs makes user highly prone to SIBO. Nearly 50% of PPI dependents experience SIBO and its health complications. What's more concerning is that SIBO diagnosis may remain unnoticed because its symptoms are similar to those of functional dyspepsia or irritable bowel syndrome. Its assessment depends on a thorough analysis of the underlying bacterial growth. This hidden epidemic is silently compromising gut health in millions of people. The rebound trap of PPIs. PPIs create a rebound trap where escape becomes a real challenge. The rebound hypersecretion of acid after each attempt of PPI withdrawal forces their users to consume them again and again to get rid of the stomach burning. The human body works under the impact of its own negative and positive feedback. PPIs powerfully reduce the generation of a stomach acid for several weeks to many months. As a result, the body's processes work to compensate for this acid scarcity by increasing their production, particularly when the consumer attempts to eliminate the PPI. With the stimulation of the gastrin hormone, the stomach produces more and more acid, thereby creating a rebound trap which is hard to escape. And this surge in the production of the stomach acid suppresses its pre-treatment levels by more than 200%. And the rebound symptoms include chest pain, severe heartburn, stomach cramps or discomfort, nausea and sleep disturbance. When a PPI-dependent patient suddenly stops taking this wonder drug, the symptoms continue to trouble them for 4 to 12 weeks. It then becomes tough to resist the symptoms for such a prolonged duration. And most of the patients prefer to offer PPIs as a long-term treatment to manage their symptoms. The PPI withdrawal symptoms are really hard to resist. When the stomach's physiology is heavily compromised with PPIs, they act as both friends and foes for the users. We really need a PPI prescription. My aim is not to demonize PPIs. In fact, their role in the systematic management of acid reflux and stomach ulcers is well evidenced in the scientific literature. My concern is only to save people from getting habituated with PPIs, specifically when their health and wellness can be effectively managed with less intensive treatments. Let us understand when we really need a PPI prescription. Long-term use of PPIs can be recommended for the following conditions. Number one is the Barrett's esophagus, which is a pre-malignant condition requiring acid suppression. Number two is the reflux or erosive esophagitis of high severity, also known as Los Angeles grade C and D. Number three is the Zollinger-Ellison syndrome involving gastrin secretion tumors in small intestine or pancreas. Number 4 is gastric ulcers or ulcers triggered by the increased use of non-steroidal anti-inflammatory drugs or NSAIDs. For a peptic ulcer complicated by obstruction of the gastric outlet, perforation, or gastrointestinal bleeding, it is essential for physicians to appropriately calculate the risk-benefit ratio before prescribing PPIs, especially in all other conditions where their use can be avoided with safer health management strategies. PPIs effectively suppress stomach acid by blocking key enzyme systems. This mechanism is crucial for their efficacy, but it must be applied with precision, not habit. De-prescribing PPIs, is it really a powerful approach? Absolutely yes. Research demonstrated that in patients without long-term PPI indications, de-prescribing is a powerful approach to minimize dependence and reduce the risk of health adversities. Scientific evidence shows that PPI prescription has met with 60 to 80% success rates. This de-prescribing and its maintenance require more than 4 months, and its success depends on whether it is implemented through structured phases. Phase 1 requires 1 to 2 weeks and involves reviewing symptoms and medical necessity, systematic monitoring of long-term complications, regular evaluation of nutritional deficiencies, assessment of health-related quality of life and associated factors. Phase 2 spans 3 to 4 weeks and includes lifestyle modifications, initiation of alternative therapy, such as histamine 2 receptor antagonist or S2 blockers, management of rebound symptoms via health education, dietary management to combat the nutritional deficiencies, and phase 3 extends from 5 to 12 weeks and focuses on a 50% reduction in PPI dose with a gap of 7 to 14 days. Symptom assessment for dose adjustment, management of severe rebound symptoms via rescue therapy, symptom control via alginate therapy if required. And then phase 4 requires at least 4 months and emphasizes continued lifestyle modifications, regular assessment of recurring symptoms, long-term follow-ups for potential complications, and prevention of relapse with appropriate evidence-based approaches. De-prescribing is not just a clinical strategy, it's a journey towards restoring gut integrity and reclaiming health. Lifestyle measures against PPI dependence. Research has testified to the effectiveness of lifestyle interventions against PPI dependence. Let us begin with dietary management. Weight loss, not hefty, but shedding a few pounds can still bring significant health improvements. Exclusion of trigger foods such as alcohol, caffeine, spices, tomatoes, and citrus fruits. Smaller and more frequent meals, avoiding food in large quantities. Preference for foods that are low in carbohydrates. This measure can result in a 30 to 40% decline in esophageal acid exposure duration. Now, behavioral modifications, maintaining a 3 to 4 hour gap between the last meal and bedtime. Avoidance of smoking. This step effectively reduces acid reflux. Stress management via robust measures such as counseling and meditation. And finally, position and time. Taking rest in a different position, head of the bed elevated to 6 to 8 inches, putting on loose clothing around the waist, sleeping on the left side of the body, standing upright after meals for at least 2 to 3 hours. A landmark assessment conducted in China involving more than 40,000 participants revealed that lifestyle management approaches were highly effective in controlling acid reflux with outcomes comparable to those of PPI-based treatment. These interventions are not just preventive, they're transformative. Alternative treatments which are beyond the PPI bottle. Several alternative treatments ensure the appropriate management of gut health while bypassing the need for PPIs. Let me walk through some of the most effective options. First, histamine type 2 receptor antagonists. Acid reduction is quite possible with the assistance of S2 blockers like famotidine. While they may not be as potent as PPIs, they offer practical benefits for many patients, especially during PPI tapering. They carry a lower risk of nutritional deficits, cause no withdrawal symptoms, and they're available over the counter. Next is the alginate therapy. Sodium alginate forms a floating barrier that protects the stomach contents. This gel-like layer prevents acid reflux before it starts, making it a reliable option from mild to moderate gastroesophageal reflux disease. The prokinetic agents are those agents that address mechanical issues tied to reflux by improving esophageal motility and facilitating gastric emptying. They help restore the rhythm of the digestion and reduce the stagnation and contributes to reflux. And finally, targeted probiotics. Restoration of the gut microbiome balance is possible with probiotics based on Bifidobacterium and Lactobacillus reuteri species. These strains help repopulate beneficial bacteria, especially in those whose microbiome has been disrupted by long-term PPI use. These alternatives are not just substitutes, they're strategic tools for healing and protecting your gut. Financial impact and red flags to watch for. The adversities caused by PPIs extend far more beyond personal health, and they carry a staggering financial burden. A health economics and outcomes research study revealed that more than $15 billion are spent annually in the US healthcare system to manage PPI-induced health complications. These costs exclude the downstream impact of chronic conditions, reduced quality of life, and lost productivity. This hidden strain on healthcare resources underscores the urgency of vigilant monitoring and proactive care. Now let's turn on to the red flags, those warning signs that must never be ignored. Gastrointestinal red flags include worsening abdominal pain, black or tarry stools, blood and vomit, difficulty swallowing, persistent nausea or vomiting, infection risk, example, infection by Clostridioides difficile, presented as persistent foul-smelling diarrhea, abdominal pain and cramping, fever and severe dehydration, and the systemic complications may manifest as chest pain, severe fatigue, muscle cramps, and seizures. These symptoms demand immediate medical attention. They're not just side effects, they're signals of deeper disruption. Recognizing them early can prevent irreversible damage and reduce the burden on both the patient and the healthcare system. The future of gut health management. My 20 years of experience in scientific research and patient management suggests that a substantial percentage of patients could have avoided preventable health complications had they utilized the appropriate treatment options and health support measures. Despite that, for severe acid-related conditions, PPI can act as life-saving interventions. Their unwarranted use as a default solution for a variety of stomach and intestinal complications has resulted in the current state of health crisis. I've seen countless patients with vitamin B12 deficiency induced by PPIs, resulting in fatigue. Many frequently experience pneumonia simply because their stomach acid is constantly suppressed. And I've witnessed dramatic improvement in mysterious gut issues among patients who received appropriate treatment for SIBO, especially those with long-term PPI use. Clinics and health support facilities witness these scenarios every day. Yet, due to the busy schedules of healthcare providers or their limited access to ever-evolving scientific evidence, the missing links to a simple acid blocker often go unnoticed. But the future of gut health management is brighter than you can imagine. Genetic testing is emerging to identify individuals with high resistance to PPIs, enabling tailored drug therapies. Treatment decisions guided by microbiome assessment offer new hope for those troubled by acid flow. And precision medicine is evolving, using diverse health risk factors to determine the most appropriate medications and dosages. Scientific approaches based on potassium competitive acid blockers, selective gastrin receptor antagonists, and gastric mucosal protective agents are focusing on novel therapeutic targets. Integrated care strategies relying on systematic assessment, lifestyle modifications, and multidisciplinary collaboration have the power to make PPI related issues a thing of the past. Outcome oriented roadmap for patients and providers. Let us now turn to a practical roadmap, one that empowers both patients and providers to take charge of gut health and minimize the risk of long-term PPI use. For patients, this is about empowering self-care. First, revisit your treatment indication. Knock your doctor's door and ask, why am I prescribed this PPI? And do I really require it anymore? Second, understand your health risks. Have you undergone recent screening for iron, magnesium, or vitamin B12 deficiency? And third, rethink your lifestyle. Reflect honestly. Have you tried any natural remedies or health support approaches ever to manage your acid reflux? And finally, formulate your PPI exit plan. A safe tapering strategy is essential to avoid long-term dependence. Remember, the higher the dose, the longer the tapering duration. For healthcare providers, this is just about guiding responsible care. Critically analyze each prescription, cross-examine the actual need for prolonged PPI treatment. Go with the latest effective dose and only for the shortest possible duration. Monitor complications consistently. Don't let PPI-induced adverse events or nutrient deficiencies go unnoticed. Proactively formulate de-prescribing strategies. This is the most effective way to minimize avoidable use of and protect the gut. And together, patients and providers can shift from reactive management to proactive healing. This roadmap isn't just clinical, it's really transformational. Parallel gut protection approaches and recommended readings. When PPIs are medically avoidable, parallel gut protection strategies become essential to safeguard your health. Let me walk you through 5 evidence-based approaches that can help mitigate the long-term effects of PPIs. First is targeted probiotics. These are most effective when prolonged PPI use disrupts the gut microbiome, leading to intestinal dysbiosis. Probiotics enriched with high colony forming units, especially those containing bifidobacterium and lactobacillus species, can restore microbial balance and improve gut resilience. Second is the magnesium supplements. PPIs often trigger hypomagnesemia or low magnesium levels. A highly absorbable magnesium glycinate formulation offers both high bioavailability and tolerance. It bypasses the need for elevated gastric acidity and supports calm digestion without causing diarrhea. Third, vitamin B12 supplements. To counter neurological risk and nutrient depletion, methylcobalamin, the bioactive form of vitamin B12, can be used. It doesn't require a highly acidic environment for absorption and supports DNA synthesis, nerve health, and red blood cell production. Fourth is the iron supplements. Iron deficiency anemia caused by PPIs can be managed with elemental iron supplements like ferrous sulfate. And these help normalize red blood cell levels, enhance oxygen transport, and reduce fatigue and dizziness. Fifth is the alginate-based reflux support. Sodium alginate forms a gel-like barrier that protects the esophagus from stomach acid. This approach complements PPI therapy and helps manage residual reflux symptoms. To deepen your understanding, I recommend exploring active research and reading on the impact of PPI on microbiome and gut health, the mechanics of long-term PPI use, and the holistic gut protection strategies. Books like Love Your Gut by Dr. Megan Rossi, The Second Brain by Dr. Michelle Gershon, and Gut by Giulia Anders offer valuable insights into the science and soul of digestive health. Empower yourself with knowledge because your gut deserves nothing less. Save your gut. Your gut is your gem. You cannot afford to compromise it at any cost. Trillions of bacteria survive in your gut. It's not just their home, it's their entire universe. Their smooth and peaceful stay in the intestine is mandatory to protect both the immune and nervous systems. Even a minor glitch in this ecosystem can trigger a cascade of health issues over a prolonged period. And when we are all aware of the culprits, why give them an easy chance? Scientific evidence clearly demonstrates that the risk of using PPIs for a longer term outweigh their benefits, particularly in those patients who do not experience critical acid-related health conditions. These risks are not just based on presumptions. They are objectively measured by an array of real-time studies and continue to impact the lives of millions across the globe. Don't take me otherwise. PPIs must be used whenever they cannot be avoided. Trust me, particularly when the need is genuine and a robust plan of action is in place to prevent long-term dependence. The lesson we get here is to be extra vigilant, say no to reflexive prescribing, and advocate for evidence-based healthcare. With ample research evidence on the table, the potential health risk of long-term use of acid blockers are no longer a secret. With this detailed evidence-based article in hand, you have every right to seek the appropriate health support. Carefully manage your acid-related symptoms and save your gut by rejecting the avoidable use of PPIs. Remember, a healthy gut is the key to practical happiness.